thanks. Okay, good afternoon. So I'll be presenting on an analysis that I led earlier this year on the economic impact of child care accessibility in Washington State. As we know, during, as we recover from COVID, child care will certainly be a topic of importance. So my team used the REMI PI Plus model for Washington State for this analysis. So I'll begin the presentation with presenting the research questions that we were seeking to answer with this analysis. I'll then discuss the approach and methodology that we used for the analysis, including our logic model, our data collection, the model input variables that we used, and the adjustments that we made to factor in the impacts of COVID-19. And finally, I'll end with a discussion of the economic impact results of the analysis. So for this study, Washington State wanted to know what the impact of the lack of access to child care for parents in the state has on their economy. To answer this question, we started with a literature review and engaged child care industry experts at ICF to understand how child care impacts households and businesses in regards to the economic implications. What we found was that child care accessibility leads to lost time at work and a reduction in labor force participation for households, and also lost productivity and greater operating costs for businesses. So based on these findings, we formulated 4 research questions to measure the economic impact of child care inaccessibility. So these questions were, how does child care accessibility impact labor force participation? How does it impact household earnings? How does it impact productivity? And how does it impact business operating costs? So here's our logic model that we developed to lay out the framework for answering these questions. So the economic impact analysis estimates the impacts of 3 scenarios or 3 different impacts that arise when parents lack affordable and reliable child care options. Those are lost time at work, increased employee turnover, and a reduction in labor force participation. So for each of these 3 scenarios, parent and employer impacts were identified and calculated using data from a survey that we did of about 2,000 parent households in Washington State. We scaled up those results to the state level using census data under the assumption that the results from the 2,000 parent households represent that of all parent households in the state. The second impact, increased employee turnover, represents the additional costs in terms of hiring, recruiting, and training a company accrues due to higher turnover rates that they experience due to employees with child care issues, and the lost productivity during the time it takes to replace those employees. The third impact, reduction in labor force participation, leads to lost household earnings and lost productivity stemming from those 3 scenarios. Parents who were not, the 3 scenarios are parents who were not employed but would be if it wasn't for child care and accessibility, parents who currently work part-time but would work full-time if it wasn't for lack of child care, and parents who had their normal working hours reduced due to child care issues. The summation of these labor force participation impacts results in a workforce that isn't being fully utilized and employers who are not producing at their full potential capacity. And again, those questions were answered using survey data. So it was primary research that we used to collect that data. So a little bit on the data collection. So the data collection process included collecting data from a number of sources. And as I mentioned, the primary source was the survey. We also used literature review, state government sources, and public sources primarily used to scale the data up and to look at the impacts at an industry basis. So we use the American Community Survey for census data, Bureau of Labor Statistics for employment data. We use the Consumer Expenditure Survey to look at the impact on consumer spending. And then we also use the REMI model itself, its baseline forecast. So data on the lost time at work, employee turnover, labor force participation related to child care issues, as I said, was collected from the survey. This data was broken out by industry and occupations based on data from BLS. Data from the REMI model baseline forecast was used to determine lost productivity based on the lost time at work and lower workforce participation. And as I mentioned, data from the Consumer Expenditure Survey was used to model the impact on consumer spending. So this data, the next step was to develop the actual REMI model inputs. So the data collected from the various sources was inputted using the REMI Guide Plus model, as I mentioned, to simulate the impact on the Washington state economy. So the lost wages from lost time at work and the reduction in labor force participation related to the inaccessibility of child care was modeled using the wage bill variable. The lost productivity from lost time at work, an increase in employee turnover, and a reduction in labor force participation was modeled using output without employment, investment, and compensation variable. And the increased employer cost from an increase in employee turnover related to the inaccessibility child care was modeled using the production cost variable in the REMI model. So we did this analysis in May. So that was just as, we're starting to understand the impacts of COVID-19. So we initially ran it and then, reran it to factor in the impacts of COVID-19. So we updated to do that, we updated the U.S. control forecast in the REMI model for the years 2020 and 2021 to reflect the revised projections based on the initial data on the impacts of COVID-19. And REMI provided us those updates, which was based on the University of Michigan's RSQE April 9 GDP forecast. But we also revised the demand for childcare in 2021 based on the higher projected unemployment as a result of COVID-19. So because of higher unemployment, there would be a decrease in the demand for childcare. So we adjusted our inputs to reflect that drop in demand. So these next few slides will look at the economic impact results. So this slide shows the impact on using the various common economic indicators from the REMI model. The impact on employment ranges from 163,000 jobs in 2019 to 109,000 jobs. So that these are jobs that, the way to look at these is that they're not actually lost jobs, but the jobs that it's the amount of additional jobs that the state would realize if inaccessibility was not to childcare was not an issue. So the number of the total employment represents about 3.7% of all jobs in Washington State in 2019. The impact on employment is largely related to lower consumer spending as a result of wages lost from lost time at work and lower workforce participation. From lack of access to childcare affects all the sectors across the entire economy, but we found in Washington State that the most significant impacts were on the government sector, healthcare, social assistance, administrative and support services, combination of food services and professional services and retail trade. The government, healthcare sectors, social assistance, administrative support services, those were where a lot of the parent households were employed in, particularly the mothers. Accommodation, food services. There are also a lot employed in professional trade. The accommodation of food services, that's reflects the induced impact where there's less spending. You get less spending in retail trade and food services. The impact on gross state product ranges from $39 billion in 2019 to about $31 billion in 2028. That represents about 7.6% of Washington's gross state product. The disproportional impact on gross state product as compared to employment is largely a result of the impact of lost productivity from lower labor force participation. As parents decide to forego working due to child care issues and remain out of the labor force, businesses lose out on the production that these workers can contribute. This dynamic has its greatest impact during times of tight labor markets and low unemployment, when businesses often cannot reach their full potential and meet demand due to labor shortages. So this was, if we look at last year prior to COVID, 2019, that's a perfect example of when this dynamic would really have a large impact. I'll go through the other ones quickly. The impact on output is similar to gross state product, since it's a component since gross state product is a component of output. Here the impact ranges from $64 billion to about $50 billion. Again, 7% of Washington State's economy, similar to gross state product. The impact on personal income is a direct result of lost wages from time lost at work and lower labor force participation, and the indirect impact on employment from lower consumer spending. The impact on personal income, as you can see, ranges from almost $17 billion to around $14 billion. That's about 4% of Washington State's total personal income. So just to summarize these results, if child care were readily accessible without common barriers to all Washington State households with children, the state would be projected to have an additional 134,000 jobs, $35 billion in additional gross state product, $57 billion in additional output, and $15 billion in additional personal income per year on average over the next 10 years. Let's skip that. So the last thing I'll look at here is the impact, the economic impact by type. So when we ran this, we actually ran 3 scenarios separately. For the final impact, they were run together to get the real impact. But to look at what major impact category or type has on the economy, which one, if there were some that had greater impacts than others, we ran 3 separate scenarios as well. Looking at just the employee turnover, looking at just labor force participation, and looking at just the lost time at work. So The impact of labor force participation represents roughly 58% of the total economic impact, while lost time at work represents 35%, and employee turnover represents 7% of the total impact. Inaccessibility child care leads to lower rates of labor force participation as household members decide not to work or work less due to child care issues. The foregone earnings that result from less labor force participation and the foregone productivity of these workers has significant impacts on the economy, and as a whole lead to a greater impact in the cost of employee turnover and lost time at work combined. So it's the labor force participation that is largely driving, and the lack of, that is largely driving these impacts. Slightly half of the total impacts. The lost time at work, a lot of that is result lost wages. So you're getting that induced impact of less spending in the economy. So here's my contact information if you want any more details about the study. I was part of a larger study on child care in Washington State. But feel free to reach out to me. I was glad to be able to present here. I hope you guys got something from it. So now I will turn it back to Remy. Be happy to